You're paying $340 a month for a medication your doctor never told you could be free. Not discounted, not through insurance loopholes, actually and completely free. And the reason you don't know about it isn't exactly an accident. It's more like institutional silence. Most pharmacists will never mention this. Your doctor's office may have no idea it exists. The pharmaceutical companies certainly aren't advertising it on the evening news. But right now, as you're watching this, there's a secret program sitting in a filing cabinet somewhere that is designed specifically to give you your medication for $0. And you need to be part of the conversation. If you like what you are watching so far, please like and subscribe and share this video so we can continue to grow this channel. The secret program is called a Patient Assistance Program, or PAP. Formal PAP programs have existed since the 1980s. They're run directly by pharmaceutical companies like Pfizer, Merck, Johnson & Johnson, and AstraZeneca. And their job is simple. If you can't afford their drug and you qualify, they give it to you. No strings. Your cost becomes zero. But only about 4% of eligible seniors actually use them. Not because they don't qualify, because they don't know they exist. I am going to explain to you the what, why, and how of PAPs. A PAP is not required by federal law, nor is it required to receive FDA approval. Pharmaceutical companies design and launch a PAP for commercial, public relations, and clinical adoption reasons. A manufacturer will establish a PAP based on 3 factors. 1. Securing market share. 2. Philanthropy and reputation. And 3. A free drug tax deduction for the companies. Think about it. If a drug has a high list price, insurance companies may put up prior authorization roadblocks before paying for it. And the PAP keeps patients on the drug while insurance fights take place. Next, providing a safety net for uninsured or lower-income individuals creates positive corporate goodwill. Finally, pharmaceutical companies can often claim significant federal tax deductions for donating their physical inventory to eligible patients directly or through a 501c3 charity. There are 4 major steps to get into a PAP. Step 1. Initiate contact and find the application. You do not call the general corporate headquarters or your insurance company or Medicare. Rather, you must locate the specific access program brand name created by that manufacturer for your specific drug. Look up the name of your medication online, followed by the words Patient Assistance Program. You may see results like Humira Complete, Pfizer Rx Pathways, or Lilly Cares. Download the PDF enrollment form. Step 2. Fill out the form. A PAP application cannot be completed by the patient alone. It is split into 2 mandatory sections, the patient section and the provider section. You fill out your personal details, insurance status, and household financial information. You must also sign a HIPAA authorization allowing the program to view your medical records and verify your insurance. Then, you must give the form to your doctor. The prescribing physician or their medical billing staff must fill out your exact diagnosis codes, dosage instructions, and sign a statement confirming the drug is medically necessary. Step 3. Submit proof of financial hardship, insurance status, and legal residency. You will need to fall below a certain multiple of the federal poverty level, typically between 200% and 500% of the FPL, which for 2026 is $15,960 for an individual or $21,460 for a married couple. So you will need your most recent federal tax return, recent W-2s or 1099s, 2 to 3 consecutive recent pay stubs, and, if unemployed, an unemployment benefit statement or a signed letter explaining your lack of income. You must also prove that you either have no insurance or that your current insurance leaves you underinsured for this specific medication. So you will need to provide photocopies of the front and back of your insurance cards, such as private insurance, federal Medicare Part D, or state Medicaid, and a copy of your pharmacy benefit rejection letter or an explanation of benefits showing that your insurance plan explicitly denies coverage for the drug or leaves you with an unaffordable copay. Finally, you will need to provide a valid U.S. street address and your social security number or green card number so they can run an automated electronic income and residency check. Step 4. Submission and delivery. Once both you and your doctor complete your respective sections and attach the required documents, the doctor's office usually faxes or uploads the packet directly to the PAP clearinghouse. If approved, the manufacturer will ship a 30-day or 90-day supply of the drug directly to your home or directly to your doctor's office at $0 cost. Even if you are approved for a full year of free medication, the manufacturer will not automatically send the next bottle or injection box to your house when you run out. To get your next shipment, you or your healthcare provider must contact the PAP program 7 to 14 days before your current supply runs out by calling their automated phone system or logging into the patient portal. They will not ship the next dose until you explicitly state you are ready for it and still taking the drug. During the refill request, a representative or automated system will ask you to verbally verify that your delivery address has not changed, your insurance coverage has not changed, and your doctor has not changed your dose. A PAP cannot ship medication without a valid prescription. So if your doctor initially wrote the prescription with 0 refills, the PAP will halt shipments, and every 12 months, all shipments will completely stop, regardless of how many refills you have left. PAPs do not roll over from year to year. You must submit an entirely new application with all updated documentation. So you can see it's a hassle. There is a lot of paperwork. There is a lot to track down, copy, and submit. Your doctor's office has work to do before and after submission, and then again for refills and annual renewal thereafter. The pharmaceutical company loses money. Is it any wonder that the Maxwell Smart cone of silence is down on the conversation? The only beneficiary is you. And quite frankly, it should be you. So, now that you are better informed, what are you going to do?